Lesroy Williams, who I know is looking right now, and Abdir Samuels. For months, we complained about the complete isolation and lockdowns imposed to control the spread of COVID-19. We wanted to get back to see our friends and loved ones and get back to work, get back to travel, get back to social gatherings and near normalcy. We were desperately looking for a way to protect ourselves as we found that we were defenseless against this killer virus that was spreading across the globe with a death toll in the hundreds of thousands. We looked to the scientific community and to God Almighty for an answer. Then our prayers were answered, and the simplicity of the solution could only be explained by a combination of scientific ingenuity and divine intervention. Wash your hands, cover your nose and mouth, keep a safe distance from others, and get vaccinated. Nonetheless, many of us still refuse to use the non-pharmaceutical methods, including wearing a mask for protection. However, despite the many maskless people we see walking the streets and flocking the bars, rest assured that the virus has not gone away, and it will still continue to infect the unprotected. Also, many continue to advance various reasons why they cannot take the vaccine, but be it medical, political, or religious grounds, the unvaccinated still remain unprotected and vulnerable to this deadly virus. There are actually very few contraindications to getting vaccinated against COVID-19, including anaphylaxis or severe allergic reaction following a previous dose of a COVID-19 vaccine, and a previous anaphylaxis or severe allergic reaction to any component of a COVID-19 vaccine. The global medical community is united in the fact that the vaccines are safe and effective and offer the best protection against severe disease, hospitalization, and death, in addition to significantly reducing the risk of catching and spreading the virus. Over 77% of the adults in the Federation have already come forward to be vaccinated, and this is commendable. Nonetheless, we must be reminded that although a significant proportion of the adults are vaccinated, the percentage of the population covered through vaccination is only 52%. This means that 48%, or nearly half of the population, still remains vulnerable to this deadly virus. Unfortunately, a significant proportion of the unvaccinated include our young, healthy adults between the ages of 18 and 40. Interestingly, this is the same segment of our society that wants to participate in contact sports, frequent the bars, have social gatherings without masks, and are looking to have carnival celebrations with little restrictions. Individuals continue to say that it's a personal choice whether or not to get vaccinated. However, a choice that does not only affect the individual making it should also be weighed against the effects it could have on others. Deciding whether to get vaccinated against COVID-19 is not a personal choice, and never was, because the consequences have always extended way beyond the individual. That decision affects all of us. When you, as an individual, get vaccinated, you make yourself less likely to get infected and less likely to become infectious and spread the virus to others, including the vulnerable. Conversely, by choosing not to get vaccinated, you are not only depriving yourself of the best personal protection available to fight off this deadly virus, but you are allowing yourself to become a vehicle for transporting and spreading the virus within the community. Last week in my presentation, I said the stark reality is that our death rate will continue to climb if we continue to deny ourselves of the best protection against the virus, which is the vaccination, and that we'll continue to come back here and report more deaths unless we choose to act now. Here is the situation. We have now added 2 more deaths, bringing the total to 27. The vast majority of the new infections continue to be among the young, the 20 to 40-year-olds. The vast majority of the unvaccinated are the young adults. The vast majority of the deaths continue to be among our elderly. 14 of those persons who died were 65 and older, including 2 who were in their 90s. To our young adults, I want to say, you may be as strong as an ox, eating healthily, boosting your immune system with the best vitamins available, and exercising regularly. Therefore, you may be able to fight off the virus with your fine health. However, you could still spread the COVID virus to the vulnerable among us, leading to their demise. For example, our 2 90-year-olds who died of COVID did not pick up the virus by going to the strip, nor the supermarket, nor a football match. They most likely had it unknowingly brought home to them by their bedsides, and that is unfair to them. Getting vaccinated is therefore not just a personal choice. It is a public health decision to protect us all. It is a necessary decision to bring an end to this public health crisis. Those who are asking that we drop our guard and relax all restrictions need only to look at Europe. 2 months ago, Denmark lifted all the remaining domestic COVID-19 restrictions as the government declared that COVID-19 was no longer an illness which is a critical threat to society. They had a successful vaccination program with 88.3% of adults vaccinated and essentially returned to pre-pandemic daily life with mass gatherings without restrictions. Now, like many countries across Europe, they are considering whether to reinstate restrictions as cases are surging, and Europe is now again the epicenter of the pandemic. If we relax our guard now, as we are coming out of this 3rd wave, we can find ourselves in a 4th wave come January after the celebrations are over and the visitors have returned to their respective homelands. Therefore, whoever can be vaccinated need to go out and do so for the protection of us all. We have seen that COVID-19 does not care about race, gender, sexual orientation, political affiliation, or even age. It is a deadly virus that will not relax even if we do. Let us continue to fight and give ourselves the best defense possible against COVID-19, which is the vaccine. How many more must die before we heed the call? I thank you.
Thanks, Dr. Cameron. We will now invite Superintendent Cromwell Henry